name is Jenna Montgomery. I'm the Public Health Educator and Communications Specialist with Neshoba Associated Boards of Health. And today I'm providing you with some updates on the COVID-19 pandemic on behalf of your local Board of Health in Lunenburg. So lots of things have changed with the COVID-19 pandemic, as we all know. So I want to give you an update on the newest guidance, what we know about the virus, what we know about vaccines, and how we can most effectively protect ourselves and others. So we're just going to briefly go over some basics of the pandemic, some things that most people are familiar with, and we're also going to discuss the newest isolation and quarantine guidance as well as vaccination updates. COVID-19 is a respiratory disease caused by a novel or new coronavirus that emerged in late 2019. Reported illness ranges from mild symptoms to severe illness and death for confirmed COVID-19 cases. So this is information that most of us are pretty familiar with, but COVID-19 is highly transmissible. Symptoms appear 2 to 14 days after exposure, and symptoms may include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion and runny nose, nausea or vomiting, and diarrhea. So here's a little bit of information from our region. Neshoba is a regional board of health, so I've got a couple of charts and graphs here to show you for our 16 towns. So the first thing I wanted to highlight is that 78.66% of COVID-19 clusters were associated with households. So what this means is most of the spread of the virus that we're seeing happens within the home. So we know it might sound odd for us to tell you you ought to be wearing a mask as you're recovering from COVID around your family members, but this is why we recommend that you wear a mask in your own home. The other thing I wanted to kind of call your attention to is the graph here showing positive cases versus deaths by month in Neshoba Associated Boards of Health towns from March 2020 to February 2022. So those purple bars are actually the deaths, and the orange line is the COVID cases. And we can see that there were a lot of deaths at the beginning of the pandemic compared to cases. And then towards the end, cases go way up, but deaths go way down. And this is because of the tools that we have to combat the pandemic, including vaccines, as well as the immunity that people develop. So we know that deaths and hospitalizations from COVID-19 have decreased over time as we have added tools to our toolbox. And most of the positive cases reported to the state in our region were involved in household clusters. So you're much more likely to get sick at home than anywhere else. Daycares were the second most common place for COVID-19 exposure, which of course will come as no surprise to people who have children in daycare or daycare workers. So the latest guidance released by the Mass Department of Public Health was released August 15th of 2022, and the newest isolation and quarantine guidance applies to all who live, work, or attend higher education in Massachusetts. These changes are based on a few things. So we have tools to fight the virus now. We've learned more about the virus and how it operates, how it evolves, and we're moving in the direction of an endemic COVID-19. What this means is COVID-19 no longer severely disrupts the lives of a majority of people. Endemic means more common and less severe, the way that we look at the common cold and the flu. As a matter of fact, at one time, the flu was a pandemic as well. As we learn more and COVID-19 evolves, this guidance may change. So what's in our toolbox anyways? Well, the first tool in our toolbox is staying up to date on our COVID-19 vaccinations. Vaccines remain our single most effective tool against COVID, lowering likelihood of serious illness, hospitalization, and death. A couple of weeks ago, the CDC authorized an updated COVID-19 booster from Pfizer for people 12 and up, and from Moderna for people 18 and older. These updated COVID-19 boosters add Omicron, BA4, and BA5 spike proteins to provide better protection that has waned since previous vaccination by targeting variants that are more transmissible and immune evading. So obviously we also have testing for COVID-19, lots of rapid antigen testing available at home. There's no longer shortages of those tests. They're easy to get. So if you have symptoms, testing for COVID is another one of the tools in our toolbox. Getting treatment if needed is another tool. So it's important to contact your doctor to see if you are a candidate for treatment based on your personal risk profile. Staying home when you're sick, which is isolating, to keep your germs from spreading to other people. Wearing a mask if you need to. And how you know you need to is by knowing your personal risk profile, which is based on your demographics, such as age, health status, and other things. While many of us have increased immunity from illness, vaccines, or both, others are still at high risk of disease. If you are at high risk of severe disease, consider wearing a well-fitting mask with greater protection in indoor public spaces or wherever you are comfortable doing so. You can find out your personal risk profile by talking with your primary care doctor. You can also enable Mass Notify on your smartphone, which is a tool that the state of Massachusetts has set up to anonymously exchange Bluetooth signals with other phones, so you will get notified if you've been around someone who tests positive that's reported to the state. You should also know your COVID-19 community level, which is a new tool from the CDC. So each community level helps convey how much COVID-19 is impacting your community using data on hospitalizations and cases. The levels are classified as high, medium, and low. And finally, the last tool in our toolbox, has been around forever, but it's proper hand hygiene, making sure you're washing your hands frequently with warm water and soap. And if that's not readily available, using an alcohol-based hand sanitizer. So next, here are some of the new guidelines for COVID-19 that have recently been released by the CDC and adopted by MDPH. So if you test positive, you're going to isolate. Isolation means separating yourself from others to keep your germs from spreading. If you're able to mask, stay home and isolate for at least the first 5 days. If you never had any symptoms or your symptoms are improving, you may end your isolation on day 6. Wear a mask around others for 10 days, including in the household. You may remove your mask prior to day 11 if you have had 2 negative antigen tests taken 48 hours apart. If you're not able to mask, you need to stay home and isolate for 10 days. And if you never had symptoms or your symptoms are improving, you may end your isolation on day 11. It's important to note that the definition of being able to mask is being able to consistently wear a mask. If you're not able to do that, it would be due to young age or a medical or behavioral condition. And additionally, if you have developed symptoms, you should continue to stay home until you have not had a fever for 24 hours without the use of fever-reducing medications, and your other symptoms should be improving. If you were severely ill, you were hospitalized, or have a weakened immune system, consult with your healthcare provider before you leave isolation. So if you test positive, isolate. Continued. There's a little chart of the days that you should isolate. Day 0 is the first day of symptoms or the day the positive test was taken, whichever is earlier. Days 1 through 4, continue to isolate. Day 5 is your last day of isolation if you are asymptomatic or your symptoms are improving. Day 6, leave isolation if you're able to wear a mask at all times when around other people, including in your household, through day 10. You may remove your mask prior to day 10 if you have had 2 negative tests taken 48 hours apart. After you have ended isolation, if your COVID-19 symptoms recur or worsen, restart your isolation at day 0. So while everyone must isolate if they have COVID, individuals may be able to return to childcare, school, or a healthcare setting sooner under certain conditions. If you are exposed to COVID-19, you should follow exposure precautions. So exposure is defined as being around someone who has tested positive for COVID-19 within 6 feet for 15 minutes or more, cumulatively. People can be infectious for 2 days before they test positive or develop symptoms. So, exposure precautions. You do not need to quarantine regardless of vaccination status as long as you have no symptoms. You must wear a mask if you are able around others indoors, including in the home, for 10 days after exposure. Isolate and test immediately if any symptoms develop, and if the result is positive, follow isolation protocols. If your test is negative or if you have remained asymptomatic, take a test on day 6. If negative, you can resume activity level as normal. So there are a few settings that might have slightly different protocols, as previously mentioned. Those include schools, childcare, and certain healthcare settings. It's important that you follow the isolation and exposure precaution guidance for the general population when you're outside of those settings. But you can access information on the Massachusetts government website through Neshoba's website at www.neshoba.org/resources. So vaccination and treatment updates. The updated booster vaccines mentioned earlier, in September of 2022, the CDC authorized updated booster vaccine formulations to protect against newer variants. So the Pfizer vaccine is for people ages 12 years and older, and Moderna is for people ages 18 years and older. Per the Massachusetts Department of Public Health, updated boosters are available where boosters have previously been administered, such as doctors' offices, hospitals, pharmacies, and community health clinics. In June of 2022, Massachusetts children ages 6 months to 4 years became eligible to receive the Moderna or Pfizer COVID-19 vaccine, so you can speak to your child's pediatrician for more information about that. The updated boosters provide increased immunity and protection against newer variants such as the Omicron, BA4, and BA5. Monovalent boosters are no longer approved for people 12 plus. Risk of severe disease is based on certain demographic characteristics such as age and certain medical conditions. So that being said, there have been some updates to treatment. COVID-19 therapeutic treatments, including monoclonal antibodies and antivirals, can help lower the amount of virus in your body and protect you from severe symptoms. These treatments are available for people who are at increased risk of severe disease and have developed COVID-19 symptoms in the last 5 days. The sooner you start treatment, the better, and call your doctor to learn what your treatment options may be. Also consider getting a flu shot to stay healthy this winter season. Neshoba Associated Boards of Health will be offering our annual flu clinics late September through October, and you can visit www.neshoba.org/calendar for details and to sign up for one of our clinics. A couple of frequently asked questions about COVID-19 and some answers for you. Can I get COVID more than once? Yes, you can get COVID more than once. Your immunity wanes over time after getting ill with the virus or getting a vaccine. Should I wait to get a booster if I'm on the younger side so older people can get it? You should not wait to get a booster regardless of your age. Getting boosted can help protect high-risk people around you. How do most people react to getting the booster? Most people who get a booster have a mild reaction, which indicates that your immune system is responding to the vaccine, which is what we want. Common side effects include pain and redness at the injection site, fatigue, chills, fever, or a headache. And will getting a vaccine or booster give me a better chance of having a mild case? So being up to date on your vaccines drastically reduces your chances of serious illness, hospitalization, or death from COVID-19. Remember, you can access the latest information on COVID-19, including updated isolation and quarantine guidelines, through our website at www.neshoba.org/resources. Neshoba Associated Boards of Health serves the public health needs of 16 towns in central Massachusetts in partnership with your local Board of Health. Thank you for watching today and stay healthy.